Hi, my name is Jessica, and this is my drawing up insulin skills video. I have all of my needed supplies here, and I will begin. So first I would verify my patient's order for the provider's order to the patient, and I would do the 6 rights of medication administration: right patient, right dose, right drug, right time, right route, and right documentation for the 6. Once doing so, I would be able to, in this case, my orders to the MAR, I would verify, which in this case I have 8 units of NPH, and I have 4 units of regular insulin, and I verified them with the MAR. Then I can go to my patient's room. I would shut my patient's door for privacy. I would hand hygiene. I'd introduce myself to my patient. I'd say, "Hi, my name is Jessica. I'm here to do your insulin for today, and I will be your nurse also throughout the rest of the day. Can you tell me your name and date of birth with their 2 identifiers?" Looking at the wristband, I would confirm their name and date of birth. "Okay, thank you." I would then ask, "Miss Smith, do you have any allergies?" They'd say no. "Okay, great." I would then hand hygiene. I would then put on my gloves. At this point in time, I would also have another nurse to verify my insulin doses also into the MAR. Okay, so I would educate my patient. I let Miss Smith know oh, excuse me, that both of these medications are to reduce sugar levels. So we want to make sure that they were eating within at least 30 minutes after administrating these medications. So I would also let them know that some side effects of these medications are hunger, thirst, weight gain, as well as sweating, and some reverse reactions. Miss Smith can be tachycardia, where your heart races really fast, seizures, and also confusion, headache, and weakness. We do not want them to occur, but if they do occur, you need to let us know right away. Okay, so first beginning, I am going to roll the vials. Okay, that one. Gonna roll this one. Alright, I then would pop my tops. I'm gonna clean with alcohol. Scrub the hub. Scrub the hub. Okay, I throw all that in the trash. I am now able to inject my air. So I'm going to inject into my NPH first, and my NPH was 8 units. Okay, so I'm going to 8 units. Alright. I don't know if you can see that. I'm trying to get it to focus. I got 8 units there. Okay, I'm going to inject this into my NPH. Okay, going to go straight down in, making sure that my needle isn't touching the medication and I'm not drawing up anything with it. Okay, I'm going to pull straight out. Alright, I then am going to do a check with my nurse once I draw up after I inject my 4 units of regular insulin. So I'm going to, with air, alright, so there's the 5 units, I'm going to go 4. I'm going to inject this one with air. Okay, so since this is 4 units, I now can invert this. And I'm going to withdraw 4 units. It's hard to see in here. Okay. Going to invert it. I would flick the air bubbles if I had any air bubbles, but I do not. Alright, so I am going to withdraw this slowly. Okay, as you can see, I have 4 units in there. I'm going to verify this with my other nurse and my MAR. Alright, so I'm going to insert this needle into the NPH and withdraw 8 units, which is going to be my total of my 12 units, making sure that I don't push down on the plunger to inject any of this in. Alright. I'm injecting it in here. Going to flip. And I'm going to pull back to 12 units. 6, 7, 10. Okay, and I have no air bubbles, so I don't need to flick. Alright. Going to pull out. Alright, I'm going to move this out of the way here for a second. And that would be in the trash. I'm going to move this box because I have to do the... Shoot, you guys can't see me. Alright, I would do the scoop method, but I don't know if this cap is going to stay on here. So I'm going to try it here. Alright, I'd scoop it up. Of course, I wouldn't touch the cap with this hand, but... Alright. Put the cap back on. Alright, and you can see I have 12 units in there, and I would verify this with my other nurse and with the MAR before giving my patient these 12 units of insulin. And then I would label this with the patient's name and date and time, and also the medication. And that would be it for the skills video.